actually not totally or completely loss of vision, but it is to see much less than normal people.
Blindness is strictly defined as the state of being totally sightless in both eyes. A completely blind individual is unable to see at all.
Why we are getting blind people? So some blind people will be like that since birth, so they have congenital reasons. They got infection during their intrauterine life, they got infection or disease while just born, or they got something acquired during their developmental age, or they got it even after they have full development and growth as adults. So what are those causes? One of the causes, of course, is infectious, which we can call it a preventable causes of blindness. Other causes are not preventable, like for example tumors, like we have also diseases which cannot be prevented, and like autoimmune diseases, which is the body are attacking their own tissues. And also we have cataracts, we have increased intraocular pressure, which is called glaucomas, which we don't know exactly the reason of its existence.
Vision problems can develop before a baby is born. Sometimes, parts of the eyes don't form the way they should.
We can still make some sort of classification for blindness in kids, because some of these cases are preventable and others are not. So how can we know, or how can we know that this is a preventable cause of blindness? Of course, as any type of medicine, the infection is definitely preventable. So we are reaching those types of infection which we call them TORCH. TORCH means an abbreviation, stands for Toxoplasma, cytomegalovirus, different types, herpes, different German measles. Those infections could happen to the mother during the time of pregnancy, are definitely can be prevented from the start, and at that time we definitely will get a healthy eyes for our kids. Definitely we have to be aware of animals, many of the animals which may carry toxoplasmosis. You know, toxoplasmosis is the disease of cats, so it can be carried by cats or dogs. So those who hold them at home, they have pets, they have to screen them well, they have to be cleared from these infections. Definitely sexually transmitted diseases during pregnancy, they may really be infected towards the mother and from the mother to the kid during labor and or during pregnancy, and this definitely these diseases are preventable. We have some statistics regarding different causes of blindness. Definitely the poorer the area, the more blindness among infants we have, and definitely the areas which is having or receiving less medical care and antenatal care, they have more incidence of blindness among kids. There is no real difference between males and females for the blindness among kids. There is no difference real, but again, the care which some people will give for their boys, maybe sometimes more. So we are seeing more complications among girls, but actually the diseases are almost, most of the diseases are 50-50. Definitely it is so difficult to treat congenital blindness, much more than acquired ones or acquired causes for blindness. We are really suffering from treating those causes of blindness whom started early in childhood, or the kid will be born with it. It is resistible, irreversible, and really very tough to deal with. A word so much medical, but we are talking about that when one problem occurs in one area of the body, it may be associated with other problems in the body. So blindness is not alone. Sometimes, unfortunately, yes, it may accompany deafness. So sometimes we will find kids who are also mute, deaf, and cannot talk, cannot hear, and also cannot see. And some infections can cause those together. Also, mental retardation is sometimes, for many reasons, can accompany blindness.
A kid's eyes might look fine, but the brain has trouble processing the information they send.
So a very famous question is asked: do the eye see or the brain see? If it is the eye, so how the eye can see? Actually, the eye is the camera which is capturing the image, which is going to the brain to be interpreted. This is how actually simply we are seeing. The image is captured from the camera, which is the eye, and you have to have a clear visual access to capture this camera, to capture this image. Meaning you have to have a clear cornea, clear lens, healthy retina. So every part of the eye has to be healthy, transparent, which is supposed to be the parts of the visual axis has to be transparent. And if we can get a good image at the end to be on the retina, which is the last part in the eye receiving the image, this image will be sent through the optic nerve. So the optic nerve is like a wire transferring this image to reach the cortex. The cortex is the part in the back of our brain, which this area is the area for the vision. So it will be received in a complicated pathway to reach this area. So you will interpret the image and to be understood by the brain. This is simply how can we see. So definitely we can simply say that the brain is the one receiving the data from the eye, but the image has to be captured by the eye itself. One of the important things to know that how can we know there is a problem about our kids, because if we don't know that there is a problem, how can we manage it? So some of these problems like glaucoma, for example, can be seen by the parents themselves. They will see something different in their eyes. The part which is colored, the eyes of the kids, the part which is colored in the eye will be white. Sometimes the kids will be tearing. Some kids will not follow targets. So mothers will say simply that my son is not following me, my daughter cannot recognize me till now 3 to 4 months, and still she is not feeling the difference between the day and night. So I will say any deviation from normal can be noticed by the mothers and fathers, of course. They will just recognize that it is not passing in the normal way. But still, we are encouraging all parents to come for screening, because some other causes of blindness or impairment of vision cannot be seen by you guys, and also can be in one eye. I want to raise this issue with you that we have two eyes, and many kids, they have a problem in one eye, and the parents will find that they are seeing well, and they will not notice that this is only by one eye, so the other eye has a problem, and they will not notice it because it is masked by the healthy one. So screening is still there, and deep-seated problems has to be checked by doctors. So when I'm supposed to do screening, if there is a problem, as early as possible, don't stick to schedules. But if there is no problems you can notice as a parent, go for screening at the age of 6 months to 3 years, as early as possible, so we can manage if there is something to do.
A baby who is blind can still learn and develop normally, but the baby's parents will need the help of specialists who know how to help blind children.
You mothers, what is the best food you're supposed to eat to have a healthy child eyes? Actually, what we want you to do is just to eat a balanced diet. Balanced diet means enough vegetables, fruits, enough proteins. This is mainly what we need, because vitamins and proteins are very important for the development of the eyes part. And one more thing to tell, that the eye is one of the very few organs in the body which will continue developing after birth. So usually kids who born, they cannot see well, so they need good food, meaning good nutrition, which is the usual what we are giving to our kids, but a balanced enough food to make them develop a normal vision during the first 6 months, which is usually the time needed to continue developing of the retina, which is the specific part which is continue developing after birth. So for those blind kids, do we can give them our eyes? Can we give them new eyes? Actually, till now, we cannot transplant a total whole eye. We can just give some parts of the eye, like a cornea. We can transplant the corneas. If there is the problem is there in this part, we can transplant it. But till now, we cannot remove a whole cornea and give it to the blind kid. So what we can do is just give a part, which is usually not early. So again, we cannot even give these parts early in life because of high rejection for kids towards any external tissue coming to their bodies, not like adults. So we are usually waiting till they will get older and see how much benefits they will get from transplanting any parts of their own bodies. Can we manage this? We will leave him. We will just say that we cannot do anything. We cannot treat you, baby, with surgery. We cannot give you any medicine to treat you. So we'll just go live your life as a blind kid. No. We will try to help again in a way which is called low vision aids. This is a big topic now and coming bigger and bigger, meaning that, you know, the difference between glasses and low vision aids, that the glasses are making you see better. But if we cannot make you see better, it means you are a low vision guy. So when the kids are getting a bit bigger and their needs will increase, we will try to make them use those ways or methods of low vision aids, which are magnifiers. Different ways of magnifying tools make the small things come very big, so they will be able to see what they cannot see. Some of them is a circle of videos, monitors, so the books can pass through the monitor and come in a very big size. Some of them are just a pair of glasses with these telescopes. Some of them are handheld. Some of them are coming to decrease the shade. So some of our kids who are not seeing well, they cannot see in bright lights. Others will see in bright light. So first we will know which type of visual impairment is there, and then we'll put the specific low vision aid which the kid will get benefit of, and this is helping a lot that they will receive a normal education, and yes, a normal one, so they will reach a good achievement and they can have a very successful career. Others, like before, we were only depending on braille way, so they will use their sensation of the fingers for to read, so they will feel the letters, so they will get some books which are they can feel the letter. It is a prominent letter, so they can feel it. It is a high letters, so they will feel it with their fingers and they will read with this braille way. But now the advance is that why not to use still our eyes, but you can see only 10%. Okay, we will make the size of your target bigger and bigger to reach your visual acuity.
Many blind people have gone on to do amazing things in many different fields, including music, the arts, and even sports.
For the last 15 years, I'm spending my life with kids. I have my experiences. I saw and I lived with many families of them. I noticed that those who have really problems in their vision and they cannot see well, they are extremely smart. They can get it much easier and faster than healthy kids. This is really amazing that they are achieving very, very good, and they are reaching very higher positions. I saw many of them in a very good positions, although they have their impairment. And how much we can help, how much they will achieve. They are not losing their opportunities, and I think they know that the opportunities are not too many. Our role is to make them easier, make them easily achieve by give them good circumstances, help them. Don't think about them that they are losers and they are not of benefit. We as humans get really till now lots of our inventions coming from blind people, by the way, and lots of our literature also came from people carrying this impairment. So I think they are really blessed, not only suffering. Actually, they are living, lots of them, very normal life. It's much better than lots of the other problems all over the body. Still, of course, they have their problems, but I think they can cope well, and I saw lots of them who can do much better than I personally expected.